Imagine a world where a simple cut could be lethal, where routine surgeries become death sentences, where a common flu could spell disaster. This is not a dystopian science fiction plot or scaremongering. It's a potential reality in 5 years if antimicrobial resistance, or AMR, continues to rise unchecked. In the hushed corridors of our hospitals, healthcare professionals nervously grapple with fear of getting infected, a growing menace worldwide. Dr. Srivatsa, the superbug maverick, who spent more than 40 years studying publishing articles about superbugs, said in Sky TV interview in 2014, "This is not a threat to humanity, but a threat to our very existence." We witnessed death of more than 10% of healthcare workers during Ebola epidemic in West Africa in 2015. More than 50% of people who died were healthcare workers. The implications for public health are profound, but lives of doctors and nurses are at stake, he warns. Meanwhile, in the pristine labs where battles against microscopic foes are fought, scientists echo the same concern. AMR is like a ticking time bomb, says Sally Davis, the Chief Medical Officer of UK. In a decade, if left unchecked, we could see our healthcare system crumbling under the weight of untreatable infections. Fast forward another 15 years and the world could become unrecognisable. The bustling hospital wards, the thriving cities, could morph into deserted relics of a bygone era. Dr. Ben Park, Director of CDC Infection Prevention USA, voices this chilling vision. If we don't act now, AMR could take us back to the pre-antibiotic era in 5 years, a time when simple infections are fatal, he cautions. The message is clear. The future of healthcare hinges on how we address this rising tide of antimicrobial resistance, and the time to act is now. In a webinar organised by CDC, 5 decision makers were silent when asked how they plan to avert the crisis. All that they said was fuel research into new antibiotics, vaccination and diagnostic tools. We must champion responsible antibiotic use in both